Hi, I'm Roger Margolis, Research Director at O'Reilly, and I'm here with Eugene Kolker, who is the CDO, and I want to talk a little about this, at Seattle Children's. So CDO, Chief Data Officer, I think it's an interesting title. I don't think there's enough of them around. Why don't you tell me a little bit what you think the role of the CDO is?
I think, the main point of CDO is to try to make data actionable, to translate data into some reasonable outcomes and ultimately benefits for patients. These are our customers. So how to make this transition using data, analytics, to make it through information knowledge, better informed decision making, and ultimately to outcomes and benefits for customers. I think this is the role for CDO.
Okay, so I will tell you a data joke.
Okay, do it.
So people talk about 80% of the time spent working on analysis is cleaning up the data, and the other 20% is spent complaining about the 80% of the time you spent cleaning up the data.
Interesting joke. I like it.
Okay.
We spend a little bit less time complaining and a little bit less time on cleaning data because we want to make them actionable. So our data distribution is a little bit different.
Good. Actually, I hear 80% is a high. It's one of those things that's in the culture to say. So you had said at your talk yesterday that there are other industries outside of health that are doing data correctly or well. And of course, we want to know, what industries do you think are kind of paving a good path for data?
So I'd say that a lot of industries who are using data and making them translated into actionable items and real significant outcomes. You can take advertising with personalized profiles, or you can take aviation with real-time managing of tickets, right? So this is done on a really decent, sophisticated level, which is tailored toward customers of this or that industry. You can take, for example, retailers, right? They're also doing a lot of interesting work. So I think healthcare is on the way towards this. We're not there yet.
Yeah, I wonder if you agree that one of the things that makes healthcare hard is that health data is different.
Yes.
So
Yes,
not only is it maybe behind in some ways, but it's just a different kind of data set.
Yes, it's different.
Which is a good segue into what are the major challenges for healthcare trying to adapt and use these kind of techniques from outside?
I'd say there are multiple. One type of challenges relates to data itself. And I think even more important is other type of challenges which are not related to data. Yesterday at workshop we talked a lot about human factor. So in an order of increasing importance and significance and complexity, I'd say that having data in place and having analytics team is kind of one type of challenge. But more importantly, you need to have buy-in from your institution, organization. You have to have in healthcare clinical champions. Without them, it's very limiting capacity of what you can do with data analytics. And at the top is, of course, empathy for people, because that's what should drive us. We are different from other industries. We are very similar in many respects, but different because in addition to economic imperatives, we have moral imperative. So we need to deliver for different type of customers for different needs.
Mm-hmm. So that's why it's good to have a CDO
It helps sometimes.
in that part.
Yeah.
So you talked about the 5 V's. Right, so you added 2 to the usual 3 that people talk about. So I'll just list them as volume, velocity, variety, veracity, and value. Given those are out there, which ones are more natural for healthcare, and which ones are the challenge for healthcare?
Thank you for reminding. Yeah, so I think it's actually a little bit even more complicated than it is, because some of them come in both very natural and they're at the same time very challenging. So, for example, if we're talking about specific of healthcare, which relates to variety and veracity, right? They come very natural. Complexity of data, different data types. This is obvious and natural for healthcare. Veracity, trust in each data set on average is not high. high, it's really, really small, right? So this is natural part of healthcare industry. At the same time, they're very challenging to deal with. And on the very top of most challenged, of course, is how to make value proposition. What kind of value at the very end, data being translated through different stages. What can they bring to institution and ultimately to our customers, patients. That's most challenging, of course.
Right. And since you're working with EMR data, it's designed for billing, right? What kind of things do you need to do to make it work for the moral imperative you described?
It's challenging. So, it's obvious that major purpose of those kind of data is very different to what we need to do. So we need to be open-minded. We need to work, in our case, our information services, our IT, knowledge managers. We need to work with clinicians to brainstorm sometimes, to come up with some unorthodox solutions. So it would be great if we have very different kind of structures within health, but this is wishful thinking, right? So you need to do best within whatever available right now. So that's basically where we are.
Great. So we've gone over some of the challenges you talked about. What do you see happening? What does the future bring for big data, healthcare, and the other way, data and healthcare? Did I say that backwards? So what I meant to say is how data is affecting healthcare and how healthcare is affecting data.
I think healthcare brings a lot of interesting problems which are interesting to deal with, right? To address. Okay, they're very different from more or less managed problems in other industries. Some of them are very different, right? Relate to veracity, for example, and variety, right? At the same time, I think we're getting closer and more similar to other industries. Our specificity is still in place, so I would say in the next few years, I would love that we have much more distributed kind of approaches similar to what's happening in other industries, much more applied across more of our industry with regard to better informed decision making, for example, okay? With regard to more personalized profile for patients, with regard to more real-time analysis and potential outcomes of them. And of course, personalized medicine is coming, but we all want that to happen earlier. It's going to happen, but not within the next few years. So we need to be realistic as well.
Well, that's great. Well, one, I really want to thank you for taking the time to talk to us. I also really want to say you come across as the moral imperative matters to you, and I think that is one of the key things that data needs. It's not just cut and dried. It's about working with people. So
yes.
I'm sure Children's Hospital is lucky to have you there. So thanks again.
Thank you very much for your time. Thank you.